Hi, my name is Krista. I'm a respiratory care student from Miami-Dade College, and I'm here to show you about trach care. First, you would get your chart and you check your order. You check to see what patient you're doing it on and what procedure you're performing, and then you knock on the door.
Hi, my name is Krista. I'm your respiratory care student for today. I'm here to do trach care. But first, let me wash my hands. You'd wash your hands with soap and water for 15 seconds. Make sure all jewelry is removed before doing this procedure. Make sure you go in between your nails, fingers, under your nails, and on your cuticles, all into your hand. Then dry your hands. Use the same paper towel you used to dry your hands to turn on the faucet. Then dot in your gloves. Before you continue with this procedure, first you have to verify the patient. You look at the wristband, you check the name, the date of birth, and the medical record, and you compare it to the chart. I know this is my correct patient and this is the procedure I'll be performing. Then you check vital signs. Respiratory rate, heart rate, and pulse ox, and the blood pressure will be on the monitor. And then breath sounds. It's very important to do the breath sounds to check for any kind of coarse crackles. So if there's any coarse crackles, you'd have to suction. Every time you feel my stethoscope, please take a breath. He's clear. Now I can begin the procedure. This is my sterile field. First I'm going to remove my gloves. It comes with a pack of sterile gloves. Place it to the side. And your sterile cloth. Make sure you only touch one side and not the inside. That will be considered your sterile field. Lay it flat. And you can get your gloves ready. With your non-dominant hand, make sure you do not touch the sterile side of the glove. Place it on top of your dominant hand. With your dirty hand, dump your equipment out. Since this is all sterile, I can use my sterile hand. Move your peroxide, place it to the side. Make sure all your equipment is ready. Now I can touch the sterile glove and place it on my other hand. I place my saline inside the big container and the two small containers. My hydrogen peroxide in the big container. It's 50-50 solution, half saline, half peroxide. Take my gauze, remove the inner cannula. Place it inside the saline and peroxide. You take your wire brush. You scrub the outside to remove any kind of excess secretions, and make sure you get inside very good. Make sure you dip it into the saline to remove the peroxide. You shake it dry. away from the patient so you don't get it into the patient. This has a locking mechanism, so when you place it in, you just turn it until you hear a little click. Now that it's done, I can clean around the sternum, but first you have to remove the gauze. You throw the gauze away. Take a clean gauze. You can dip it in here, I find it easier, with the hydrogen peroxide and the saline. Clean on the outside and around underneath. Take a Q-tip. Dip it in the hydrogen peroxide and saline as well to get in the little crevices and around the sternum very well. Take your other Q-tip, dip it strictly in the saline to clean around the sternum to try to remove all the hydrogen peroxide. Take another gauze to dry it. Make sure all the peroxide is off because it becomes irritating for the patient. Place a new gauze underneath. Be gentle and careful so you don't irritate the patient. Make sure the slit is facing upwards towards the patient to make it easier for you. Since the trach always has to be secure, I find it easier when I'm changing the necktie to leave the old one on and place the new one on, right on top. This way it always remains secure, because if it's not secure, you can lose the trach inside to the patient. Make sure it's 2 finger lengths. Since the new one's on and it's still secure, I can now remove the old one. And discard it. The red hazard. Since this is now complete, now I have to do my post-vital signs. Same thing, respiratory rate, heart rate, blood pressure on the monitor, and the pulse ox to make sure that the patient is still okay with the procedure. And now I'm going to check the breath sounds to make sure there's no forced crouches. Same thing, if you can breathe from here, I'm going to my stethoscope. Before leaving the room, make sure your patient is safe and secure. Lift up the bed rail. Throw all your equipment that you use in the red biohazard bag. Remove your gloves. Place the red biohazard. Wash your hands for 15 seconds. Make sure you get in between your fingers, under your nails, around your cuticles, all the way to your wrists. And dry your hands. That's it. You leave the room and you chart. You chart the procedure, trach care, the pre-vital signs, the post-vital signs, and when you are cleaning the trach care, if there is any secretions, you dot the color and the consistency.